Hello everybody, this is Sierra and I'm here with Dr. Apgar. She is our medical director here at Greenhouse Wellness. We are doing a weekly series that we're going to do every Monday with her called Weekly Medical Chat with Dr. Apgar. Today we are going to be talking a little bit about terpenes, and we're going to do kind of like a beginner's lesson on why they're so important. And if anybody has questions, hi Kate, tell me where you're tuning in from when you come in. Say hello and let us know if you have any questions and we will answer them. So we're gonna just wait to see a couple more people tune in. And in the meantime, Dr. Apgar, why are terpenes important? Just tell us a brief gist of what they are, why they're so important when we talk about medical cannabis.
Hi everybody. So terpenes are very, very important in cannabis. In fact, a lot of people would argue that they're the most important thing in cannabis, especially as we're moving forward in the science of cannabis. But terpenes are everywhere, actually, and you've probably already eaten terpenes and never known. They're in many of our spices. Myrcene, for example, is in mangoes. We've got limonene, which is in lemons. We've got linalool, which is in lavender. We've got humulene, beta-caryophyllene. There are a lot of different terpenes, and they all work synergistically together with the plant to create different effects. So if you're looking to feel uplifted, you might look for a terpene that is high in pinene or limonene. And if you're looking to feel relaxed, you might try one that has more myrcene in it. So terpenes are very, very important.
Love that. So how else do we use terpenes for medical benefit?
So honestly, a lot of patients will come in and they'll tell me that they want a sativa or a indica. And what we have to do is explain to them that those don't necessarily exist in true form anymore. There are no such things as a sativa or an indica. Everything is basically a hybrid. So when somebody tells me that they're looking for a sativa, say, I know that what they're looking for is more of that mental alertness, or they want more of an uplifting or an energetic strain. And so that's where I look to the terpenes to help guide them in what effects they're looking for. So that's how terpenes help us here.
Awesome. So we talk a lot about focusing on smokeless here. Tell us a little bit about why that's important and how that relates to terpenes.
So smoking, meaning combusting with a flame, cannabis, ends up burning off all these molecules, and so the body doesn't get the effect that it needs. So when we talk about smokeless, we really prefer our patients to vaporize the flower or the concentrates if possible. And when you vaporize, you're able to turn the settings low enough that you get all the medical benefits of those terpenes. They're not burned off during the combustion process. And that's why the medical benefit is even greater than if you smoke the product.
Awesome. A lot of people don't know that. We get lots of questions about why we suggest that, and that is why, because we want everybody getting the full medical benefit.
Right.
Kate commented that essentially everything is a hybrid, which is true. What products do we have currently in-house that are high in terpenes?
So that's a great question. So actually, we're very excited. We just got some shatter in last week, and we got something that people might not know about. It's called ZAM, or Zamandelica. So we call it ZAM for short. And this would be what shatter looks like. And this is very energizing. So it provides focus, it provides energy, motivation, and you would just use a small grain of rice in a pipe, or in a pen, in a concentrate pen, to use this. But this is going to be great as an anti-inflammatory because it has humulene, pinene, beta-caryophyllene, and a ton of myrcene, like 4.5% of myrcene, and that is amazing. So you've got really strong anti-inflammatories. And these compounds even work together synergistically to combat cancer cells. So this would be a great strain for somebody with chronic fatigue, or anybody that has chronic pain, fibromyalgia, say, migraines, headaches. This is a great strain for that. So we're very excited to have these in. We have a lot of it, so we're excited to let the patients give it a try and give us their feedback.
Yes, we have a question. So you're saying that it has anti-inflammatory properties, so does that mean it will help with rheumatoid arthritis?
Absolutely, absolutely.
Okay, perfect. What is your current favorite product that we have in and why?
So honestly, because we get so many people that have no idea what they're doing and this is very intimidating to them, this is one of the easiest things to teach a patient how to do. Number one, it requires no education whatsoever. This is a disposable vape cartridge, so it's preloaded with medicine. This is actually an uplifting, this is the TNG, this TNG strain. And all you do is you put your mouth up to the end and you inhale and you get a dose of medicine. So I love the easiness of this. It's not intimidating to the patients. And the other thing I love is I love immediate gratification. And this is something that will make you feel better within, seconds to minutes. And that really matters when you're suffering from pain. So I think right now this is my favorite product that we're selling.
Love it. Thank you. All right, guys. Well, continue to ask questions. We're going to end our live today, but we will continue to respond if anybody has any questions. Comment and let us know that you're watching the replay once we're all finished so we can come back and say hi. Have a great day, everybody. Thanks, Dr. Apgar.
Thank you.